Will the House please come to order and members kindly take their seats? Good afternoon. The devotional today will be led by Ed Sunday Winters, who is a pastor at Greensboro United Church.
Thank you, Madam Speaker, and greetings from Greensboro. I'm grateful for this opportunity to be with you today. A reading from the Gospel of Matthew, chapter 25, verses 37 through 40. Then the righteous will answer him, Lord, when was it that we saw you hungry and gave you food, or thirsty and gave you something to drink? When was it that we saw you a stranger and welcomed you, or naked and gave you clothing? When was it that we saw you sick or in prison and visited you? And the king will answer them, truly I tell you, just as you did it to one of the least of these brothers and sisters or siblings of mine, you did it to me. Meister Eckhart was a medieval mystic and philosopher who said, or who is said to have said, if the only prayer you ever pray is thank you, that will be enough. And that's the prayer that I pray most often for you. And that's the prayer that I pray for you today, and for the work that you do in this place. Thank you for your willingness to serve your neighbors in this way. Thank you for always remembering Vermonters who are hungry, who are in need of shelter, who are in need of health care, who are in need of a humane justice system. Thank you for cooperating and collaborating together. Independents, progressives, Republicans, and Democrats doing what is best and what is needed for Vermonters. Sadly, we live in a time when working for the common good seems to have become something of an antiquated notion. Thank you for breathing new life into that idea every time you walk through these doors. In the Christian tradition, this week is Holy Week. And so with all the meaning and all the hope that this week holds, I say to you what I pray for you. Thank you. Amen.
Members, we have a joint Senate resolution to take up at this time. JRS 22 is a joint resolution relating to weekend adjournment on April 18th, 2025. It was offered by Senator Baruth and was read and adopted on the part of the Senate. Please listen to the reading of the resolution.
Resolved by the Senate and House of Representatives that when the two houses adjourn on Friday, April 18th, 2025, it be to meet again no later than Tuesday, April 22nd, 2025.
Now you've heard the reading of the resolution, and the question is, shall the House adopt the resolution in concurrence? Are you ready for the question? If so, all those in favor, please say aye. Aye. All those opposed, please say nay. The ayes appear to have it. The ayes do have it, and the resolution is adopted in concurrence. Members, we have received requests to read two House concurrent resolutions that the House and Senate adopted pursuant to the consent calendar. The first is HCR 37, which is a House concurrent resolution congratulating Mira Siri of Brattleboro on being named Miss Vermont 2024. Please listen to the reading of the resolution.
Whereas the Miss Vermont contest is not merely a beauty pageant, but a competition for scholarship awards that highlights the talents and interests of the contestants who are from across the state. And whereas Mira Siri, an impressive young woman from Brattleboro, graduated due to her creative initiative debt-free from the George Washington University in Washington, D.C. as a photojournalism major, has worked as a digital producer in the office of U.S. Senator Bernie Sanders, among other projects, documenting the impact of the devastating July 2023 flood, has been admitted to graduate school at Champlain College in Burlington, and is an outstanding vocal soloist. And whereas she was one of the most promising 2024 aspirants for this honor, and her first pageant experience was at the 2017 Brattleboro Winter Carnival pageant, where she won approximately $1,500 in scholarship prize money. And whereas initially Mira Siri vied for the Miss Vermont title in 2021 and tried again in 2023, when she was awarded second runner-up honors and named Miss Southern Vermont. And she has also earned recognition as Miss Heart of Vermont. And whereas her third attempt proved to be the pinnacle of her success, when on April 14th, 2024, at a ceremony held at Spruce Peak Performing Arts Center in Stowe, Mira Siri was thrilled to be named Miss Vermont 2024, and she was the recipient of 2 scholarships, one for $7,500 from the Miss Vermont Scholarship Organization, and a second for $5,000 to attend the Ellis Strategies Public Speaking and Presentation course. And whereas in 2024, Mira Siri's community service initiative focused on sustainability and was entitled Green for Good. And one aspect of the project was a partnership with Green Up Vermont that resulted in a Guinness World Record for the most volunteer pledges, 6,833, to clean up trash in one day. And whereas, although not a finalist at the Miss America contest held at Disney World in Florida from December 28th, 2024 to January 5th, 2025, Mira Siri enjoyed competing at this prestigious national event. Now, therefore, be it resolved by the Senate and House of Representatives that the General Assembly congratulates Mira Siri of Brattleboro on being named Miss Vermont 2024, and be it further resolved that the Secretary of State be directed to send a copy of this resolution to Mira Siri.
Next is HCR 71, which is a House concurrent resolution celebrating the 40th anniversary of the first class at Landmark College and extending best wishes for continued academic success. Please listen to the reading of the resolution.
Whereas individuals who learn differently, whether due to autism, dyslexia, attention deficit disorders, executive function challenges, or otherwise, have historically faced major impediments to fair, accessible, and quality education. And whereas until 4 decades ago, there were not any accredited higher education institutions designed and built exclusively for individuals who learn differently. And in response to the need for this type of school, in 1983, a committed team of educators, philanthropists, and community leaders, including then Putney Select Board member and future governor Peter Shumlin, himself dyslexic and unable to read until he was 14 years of age, established Landmark College in Putney, Vermont. And whereas Landmark College accepted its first students in the fall of 1985 and quickly became the world's first accredited college for individuals with learning disabilities and learning differences. And whereas over its 40-year history, Landmark College has broadened the curriculum to include other academic degrees and certificate programs, academic development and college preparatory programs for high school students, and professional development and certificate programs for educators. And whereas in addition to the academic courses, Landmark College is a global leader in advancing accessibility, inclusion, and opportunity for those who learn differently. And whereas nearly 11,000 students and professionals from 55 different countries have studied at Landmark College, opening new doors of opportunity for those who learn differently and preparing them for academic and career success. And whereas the school is the largest employer in Putney and one of the largest year-round employers in Southern Vermont. And whereas the outstanding achievements of Landmark College serve as a glowing testament to the dedication and perseverance of all those associated with this unusual and respected higher education institution. Now, therefore, be it resolved by the Senate and House of Representatives that the General Assembly celebrates the 40th anniversary of the first class at Landmark College and extends best wishes for the continued academic success. And be it further resolved that the Secretary of State be directed to send a copy of this resolution to Landmark College.
Are there any announcements? Member from Glover.
Madam Speaker, our devotional this afternoon was provided by Ed Sunday Winters, the pastor of the Greensboro United Church of Christ. I want to thank Ed for reminding us of the complex and meaningful work we are engaged in here at the State House and of the importance of approaching it with both humility and compassion. Pastor Ed has served the Greensboro United Church of Christ for many years. He is warm, kind, and jovial, qualities that shine through in everything he does. I'll admit that until quite recently, I haven't always felt entirely at ease attending church. Like many, I hadn't gone regularly since childhood when my mom insisted I had to go to Sunday school. And when it became time to forge my own spiritual path, I became more likely to find my solace in nature. But lately, my 8-year-old daughter has taken an interest in Christianity, and as a parent, I felt it was important to play an active role in guiding her religious education. I took time to carefully choose an open and affirming congregation where both of us would feel comfortable and welcome. We are incredibly fortunate to find Ed, who I'm now convinced might be the only person on earth capable of getting my daughter excited to wake up early on a Sunday morning. A few weeks ago, I asked her what she actually liked about going to church. Her first answer was the coffee hour because there are good snacks. I reminded her that that wasn't really a sufficient reason, since we could just buy good snacks for home. Without missing a beat, she replied, "Well, we can't buy Ed." I laughed because it's absolutely true. Ed has a rare gift for offering truth, warmth, and compassion in a way that resonates across many generations and systems of belief. He helps people of all ages, and perhaps especially children, feel heard, respected, and valued. My daughter calls him her friend, and I am truly grateful to have him as a role model in her life. Beyond the pulpit, Ed brings that same love for all people and commitment to social justice into his broader work in the community. He has served as co-chair of the Hunger Council of the Northeast Kingdom, a board member of the Northeast Kingdom Collaborative, and as a member of the Coordinating Council of the Vermont Poor People's Campaign. Alongside his wife, Patty, who is just as devoted in her service to the community, Ed provides compassion and concrete support to those in need. Pastor Ed is a deeply valued member of the greater Greensboro community, and we are lucky to have him here today. Madam Speaker, I hope the body will join me in warmly welcoming Pastor Ed Sunday Winters to the State House.
Will the guest and the member from Glover please rise and be recognized? Member from Burlington.
Madam Speaker, in painful contrast with today's devotional, many of us felt ambushed by yesterday's presentation and found it deeply inappropriate, and I know that some of us found parts of it offensive. The members of the safety team who joined us here were equally appalled by what they heard, and they have composed a letter of apology, and I'd like to ask your permission to read it to the body.
You may.
And while this is addressed to the Speaker and representatives, I believe it is intended to be addressed to all the members of the staff and all the guests that were here yesterday. Dear Madam Speaker and representatives, on behalf of the safety team, I want to apologize to you and the full House of Representatives for the devotional offered by our instructor in training on April 15th. We invited her to offer the devotional in honor of the courage and resilience of survivors of sexual assault and to highlight the possibility of healing. We shared with her the clear guidance we were given, asked her to watch the videos of several other devotionals, and trusted that she would follow the guidelines and examples provided to her. In hindsight, we should have reviewed her remarks to ensure they aligned with those expectations, and we're very sorry that we did not do that. Instead of a devotional, she delivered a politicized speech. The opinions and content she shared were entirely her own personal views. While recognizing the bravery it took for her to share her personal story, we are dismayed that she disregarded the established guidelines and the spirit of the devotionals, and deeply regret the disrespect this demonstrated. The safety team was honored to be invited into the House chamber, and we hope that you, Madam Speaker, and the House will accept our apology. We are grateful for your work on behalf of all Vermonters. Sincerely, Genevieve Henry, Executive Director.
Thank you. Member from Brattleboro.
Madam Speaker, we heard the reading of the resolution honoring Mira Siri of Brattleboro. I'm so impressed to know of Mira's many accomplishments, even prior to becoming Miss Vermont. These include a BFA in photojournalism from the prestigious George Washington University, working as a digital producer for Senator Bernie Sanders, and advocating for sustainability and environmental responsibility with her community service initiative. Mira's concern around the issue of climate change is something dear to my heart. is the problem that prompted me to run for the legislature 16 years ago. It's heartening to know how committed and knowledgeable she is about the impacts of climate change on our Vermont towns. I know that she will continue to make a difference by raising awareness of this issue. I'm so honored that Mira grew up in my legislative district in Brattleboro. And on a personal level, I taught figure skating to Mira when she was a young child, something that I recently discovered. She eventually became a hockey player, but that's okay. I know that Mira will continue to impact her community, state, and country. She's a most impressive young woman. Mira is here with us today, and to my surprise, several of her cohort came to support her today. Other honorees, we have with us Miss Chittenden County Teen, Ava Lovely, Nina Smith, who is Miss Green Mountain Teen, and Nina's mom, Alicia Foss. So please welcome this impressive group and to the People's House. Thank you.
Will the guest from the member from Brattleboro please rise and be recognized? Member from Putney.
Thank you, Madam Speaker. Today we heard a resolution honoring Landmark College in Putney on its 40th year in serving neurodivergent students. Landmark College has carved a place in our little town that we're very grateful for, as well as planting its flag on the national educational landscape, serving students, as they say, who learn differently. They are the college for students who learn differently. Today we are joined here in the House by their president, Jim DeLagos, staff member Lachlan Francis, our native son back there, and by students Grace Nelson and Daniel Cabanas. Could you please join me in welcoming them to the People's House?
Will the guest from the member from Putney please rise and be recognized? Are there any further announcements? Member from Cabot.
Thank you, Madam Speaker. I'd like to welcome the Northern Star Homeschool Co-op to the body. They are from my district, Cabot, Danville, and Peacham. Vermont has over 3,000 homeschoolers who are often underrepresented and underestimated. One of them, Molly, was a page during this session. Will the body join me in welcoming these fine young Vermonters?
Will the guest member from Cabot please rise and be recognized? Member from Bennington.
Thank you, Madam Speaker. I would like to remind members that tonight from 6 to 8 p.m., the Vermont Retail and Grocers Association is hosting a legislative reception. There will be business owners present from across the state and, of course, free food. I hope you will join them tonight to have a chance to chat with businesses in the Capitol Plaza. Maggie, who has done a great job organizing this event, has drink tickets available, so find her after the floor and grab one before they run out.
Member from Burlington.
Madam Speaker, today we have a special guest, Juliana Rhee, who has been serving as one of 2 interns for the House Progressive Caucus this biennium. Juliana is an environmental studies major with a minor in law and society, is passionate about human rights and environmental advocacy, and aspires to attend law school after her graduation this spring. Juliana is originally from Hawaii and plans to return after graduation, and as an undergraduate has conducted research on Indigenous Hawaiian roles in environmental policymaking and governance. Here in the State House, Juliana has provided her talent to conduct invaluable environmental policy analysis and is in the process of working with the member from Putney, his intern Jonah, and myself to plan an event that will take place next week. To that end, I invite all members to join the Vermont Commission of Native American Affairs for an evening with the Vermont Abenaki next Wednesday in room 11 from 4:30 p.m. to 6 p.m. Former Representative Catherine Sims will be moderating. Speakers include scholars and chiefs of the 4 Vermont state recognized Abenaki tribes, and there will be time reserved for audience questions.
Member from Brattleboro.
Madam Speaker, last Friday, I engaged in behavior that was not in keeping with our House decorum, and I would like to apologize to you and the body that takes away from the valuable, important work that we do when anyone does that, and I'd like to apologize. Thank you.
Are there any further announcements? Member from Burlington.
I'm sorry, Madam Speaker. I meant to ask the body to welcome our guest.
Will the guest of the member from Burlington please rise and be recognized? Member from Essex.
Thank you, Madam Speaker. I was very excited to see the return of the member from Hartford, and I just wanted to note that we have very much missed his presence and would like to welcome him back as warmly as possible.
Welcome back, member. Member from Calais.
Madam Speaker, I move that the Committee on General and Housing be relieved of House Bill 253, which is an act relating to workforce housing zones, and that the same be committed to the Committee on Environment.
The member from Calais moves that the Committee on General and Housing be relieved of House Bill 253, an act relating to workforce housing zones, and the same be committed to the Committee on Environment. Are you ready for the question? If so, all those in favor, please say aye. Aye. All those opposed, please say nay. The ayes appear to have it. The ayes do have it. And you have relieved the Committee on General and Housing of House Bill 253 and committed the same to the Committee on Environment. Are there any further announcements? Member from Tunbridge.
Thank you, Madam Speaker. Today, my older sister, Betsy, is visiting from Philadelphia. She grew up on our family's sheep farm in Tunbridge. She also attended, I think, almost as many schools as we have representatives in this body. I count, to my memory, the New School in Plainfield, Tunbridge Central School, the Newton School in Stratford, Marion Cross School in Norwich, the East Hill School in Andover. She was not a delinquent. She is joined by her husband, Philip, the Quaker she fell in love with, their younger son, Owen, who's enjoying his 29th birthday today, their daughter, Emma, and son-in-law, Aaron, and first grandchild, Will. Please help me welcome them to the People's House. They are sitting in the balcony.
Will the guest of the member from Tunbridge please rise and be recognized? Are there any further announcements? Member from Northfield.
Thank you, Madam Speaker. Madam Speaker, many members, particularly from prior sessions, are aware that I've been engaged in a fairly in-depth long-term project working to identify the individuals, former patients who were buried on the grounds of the Vermont State Hospital in the early years of the hospital, both to identify them and to locate the grave places. At a certain point last fall, I started realizing that I should put what I found together in a report and then get it into a format where it could be preserved for other people working or researching and to have it bound. Yesterday evening when I got home, I found in my mail the first bound copy. I thought it would be really unseemly to show it off on the House floor and brag about it. And so I found a really good excuse. There's an important little excerpt, Madam Speaker, that I'd like to read.
You may.
In the portion that talks about the help that I got from many people who were interested and eager to pitch into the work. And in that section, there's an entry that says, when I was trying to locate town cemetery listings at patient hometowns, fellow legislators took on tasks of checking with their local town officers to save me from some of my travels around the state. In 3 cases, their work led to direct identification of a gravesite. So I thank the assistance of members of this body for their work.
Congratulations, member. Are there any further announcements? Seeing none, orders of the day. Members, we will begin with House Senate Bill 18, which is an act relating to licensure of freestanding birth centers. The bill was referred to the Committee on Healthcare, which recommends that the House propose to the Senate that the bill be amended as printed in today's calendar. The member from Rockingham, Representative Goldman, will speak for the committee. In affecting the revenue of the state, the bill was then referred to the Committee on Ways and Means, which recommends that the House propose to the Senate to amend the bill as recommended by the Committee on Health Care. The member from Georgia, Representative Brannigan, will speak for that committee. And then carrying an appropriation, the bill was referred to the Committee on Appropriations, which also recommends that the House propose to the Senate to amend the bill as recommended by the Committee on Health Care. The member from Morristown, Representative Iacovone, will speak for that committee. Please listen to the second reading of the bill.
S18, an act relating to licensure of freestanding birth centers.
Member from Rockingham.
Madam Speaker, S18, an act relating to licensure of freestanding birth centers, was received by the House Committee on Health Care from the Senate and recommends that the House propose to the Senate that the bill be amended in this strike-all amendment. The vote in your House Health Care Committee in support of this amendment was 11-0-0. You will find this bill on page 1562 of today's House calendar. The birth of a child is a remarkable biological event, an intricate process shaped by millions of years of evolution. From a single fertilized egg, the human body forms with astounding precision. Organs develop, the brain begins to function, and a new life prepares for the outside world. Labor and delivery are complex physiologic processes involving finely tuned coordination of multiple organs within a woman's body. Birth is not only a medical marvel, but also a deeply human experience where science and nature converged to bring forth a new life. A freestanding birth center is a healthcare facility designed specifically for childbirth, offering a warm, home-like environment outside of a hospital setting. These centers are typically staffed by licensed midwives, nurse midwives, and sometimes physicians, and they focus on providing care for healthy, low-risk pregnancies. Freestanding birth centers emphasize a natural approach to childbirth, supporting minimal medical intervention while still maintaining access to essential safety protocols and emergency care plans. They are equipped to handle labor, delivery, and immediate postpartum care with features like birthing tubs, spacious rooms, and family-friendly accommodation. Although they operate independently from hospitals, most birth centers have strong collaborative relationships with nearby hospitals in case a transfer becomes necessary. Witnesses provided testimony that care in freestanding birth centers provides a safe and satisfying option for many families, results in lower rates of preterm birth, leads to a lower incidence of low birth weight, and reduces costs by more than $2,000 per mother-infant pair. For some families, freestanding birth centers fill a gap as they would prefer the safety of the birth center compared to a home birth and avoid the medicalization of a birth in a hospital. Currently, families in Vermont are traveling to states outside of Vermont to have their babies at birth centers. S18 aims to fill this gap. I will now review the sections of the bill as amended. In Section 1, Chapter 53 is added to 18 VSA. Section 2351 adds definitions, starting with the definition of a birth center, which means a facility whose primary purposes are to provide midwifery care, low-risk deliveries, and newborn care. Definitions go on to include the definition of a certified nurse midwife, change of ownership, corrective action, licensed maternity care provider, licensed midwife, and licensed provider. These definitions were clarified at the request of the Office of Professional Development. Section 1 is also clear on the licensure and prohibitions in Section 2352. This includes that no person shall operate a birth center without first obtaining a license from the Department of Health in accordance with this chapter. A birth center shall not offer or provide epidural anesthesia or cesarean delivery, that it may be independently owned by a licensed midwife or a certified nurse midwife, that no person represent itself as a birth center or use the term in advertising or publications unless the person has been licensed as a birth center in accordance with the provisions of this chapter. And a license is not transferable or assignable and shall be issued only for the premises and the person named in the application. Section 2353 delineates that an application of a birth center shall be made to the Department of Health in the manner specified by the department, and that each application for an initial license, renewal of license, or change of ownership shall be accompanied by a fee of $250, which will be addressed by the Committee on Ways and Means. Section 2354 reviews license requirements by the Department of Health. Section 2355 reviews procedure for revocation of the license by the Department of Health. Section 2356 reviews procedures for an appeal of an action by the Department of Health to condition, deny, suspend, or revoke a license in any case in which there has been failure to comply with this chapter, making clear that recourse can be sought through Superior Court. Section 2357 outlines the procedure for inspections and actions open to the Department of Health should the birth center be found out of compliance. Section 2358 delineates the requirements for maintenance of the confidentiality of materials received by the Department of Health, except as it relates to the summary reports of violations required to be posted on the department's website, pursuant to Section 2357 of this chapter. Section 2359 delineates that the Department of Health shall adopt rules in accordance with 3 VSA Chapter 25 needed to carry out the purposes of this chapter. The rules shall be based on the National Birth Center Standards published by the American Association of Birth Centers. The rules that shall be included at a minimum are clearly listed in this section. Section 2360 states that nothing in this chapter or in rules pursuant to this chapter shall have an effect of the scope of services that a licensed provider may perform at the birth center or in a space adjacent to the birth center, as long as the provider of that care is working with the licensed provider's scope of practice. Section 2 of S18 adds a birth center to the entities that a health insurance plan or health benefit plan providing maternity benefits shall provide coverage. Section 3 amends 18 VSA Section 9435 to exclude birth centers from the Certificate of Need process. Section 4 requires the Agency of Human Services to seek approval from the Centers for Medicare and Medicaid Services to allow Vermont Medicaid to cover all services at birth centers, including professional fees and facility fees. Section 5 is the effective dates. Section 1, birth center licensing shall take effect on January 1st, 2027, or the effective date of the birth center rules adopted by the Department of Health, whichever comes first. Section 2, 8 VSA Section 4099D, midwifery insurance coverage shall take effect on January 1st, 2027. Section 3, 18 VSA Section 9435A, Certificate of Need exclusion shall take effect on July 1st, 2025. Section 4, request for federal approval for Medicaid coverage shall take effect on passage, and Medicaid coverage shall begin on the later of the date of either approval from CMS or the effective date of the birth center rules adopted by the Department of Health. And Section 5, the effective date section, takes effect on passage. Witnesses included: Executive Director, Vermont Medical Society; Chief Operating Officer, Italia; Staff Attorney, Green Mountain Care Board; Owner, Gentle Landing Birth Center; Deputy Chief Counsel, Office of Legislative Counsel; General Counsel, Office of Professional Regulation, Secretary of State's Office; Long-Term Care Licensing Chief, Department of Aging and Independent Living; Physician, Department of Obstetrics and Gynecology, UMass Chan Medical School, Bay State Medical Center; Legislative Liaison, Vermont affiliate of the American College of Nurse Midwives. Certified Full Spectrum Doula, Vermont Doula Company. Vice President of Government Relations, Vermont Association of Hospitals and Health Services. Sponsor, Senate Committee on Health and Welfare. Deputy Secretary of State, Secretary of State's Office. Nurse Midwife. General Counsel, Vermont Department of Health. Member, Vermont Birth Center Coalition. Nurse Midwife, Copley Hospital. Director of Communications and Legislative Affairs, Department of Vermont Health Access. Director, Government, Public and Media Relations, Blue Cross Blue Shield. The vote in your House Health Care Committee in support of S18 was 11-0-0, and we respectfully ask for the body's support.
And now, speaking for the Committee on Ways and Means, member from Georgia.
Thank you, Madam Speaker. The Ways and Means Committee, up in room 44, we deal with numbers and tax policy. We do not deal with policies raised by the tasks suggested within the bill. S18, an act relating to the licensure of freestanding birth centers. The members have already heard, Madam Speaker, a good summary of this bill, including background and details. Because this is mainly a bill that contains fees, I considered rewriting my report, but then I realized that this bill is really all about the delivery. All about the delivery. So, Madam Speaker, okay, that's the only joke I have. So regarding the fiscal impact, Section 1. Section 1 would create a $250 fee license for applications, renewals, or transfer of ownership. So anytime one of these facilities involved any of those changes, applications, renewals, or transfer of ownership, the $250 fee would be due. The fees collected would be deposited into the hospital licensing fee special fund and be available to the Department of Health to offset the costs of licensing. Initial costs and incoming revenues from this fee are anticipated to be nominal and depend at this point on the number of applicants, which is unknown. Section 2 requires health insurance plans to cover prenatal, maternity, postpartum, and newborn services provided at these new licensed birth centers. The Vermont State Employees Health Plan and Blue Cross Blue Shield plans already cover these areas. So most of the insurance plans in the state are already covering them. Section 4 would direct the Agency of Human Services to seek approval from Vermont Medicaid to cover these services. I have complete copies of the joint fiscal report for S18 here at my desk if members would like more information. Ways and Means heard from the following witnesses while taking testimony on this bill. The Deputy Chief Counsel of our Legislative Council, the legislative liaison of the Vermont Alliance of American College of Nurse Midwives, the principal fiscal analyst in the Joint Fiscal Office, and the general counsel in the Vermont Department of Health. In support of the bill as amended, the committee voted 10-1-0 in favor of this bill, and we look forward to your support, Madam Speaker.
And now speaking for the Committee on Appropriations, member from Morristown.
Thank you, Madam Speaker. Your Committee on Appropriations has reviewed S18 and the amendment. We met with staff from the Joint Fiscal Office and went over the fiscal note at that time, and also met with counsel from the Legislative Council to review the bill in its entirety. Our decision, we agree with the Joint Fiscal Office that the fiscal impact on the state is de minimis and negligible, certainly initially. In fact, it's possible that over time, savings could accrue to our Medicaid program if more births were done at the freestanding birthing center than in a traditional hospital based. So your committee supports this. The vote was 902, and we ask for your support.
The question is, shall the bill be amended as recommended by the Committee on Health Care? Member from Fairfax.
Madam Speaker, may I interrogate the presenter of the bill?
The member from Rockingham is interrogated.
Thank you, Madam Speaker. As I was listening, I understand that the committee did hear from doulas. My understanding of doulas is that they are certified. There is no national licensing for doulas. Would they be considered a licensed maternity care provider in the definitions and of this bill?
No.
Okay. And then, so again, I'm looking at definitions. Birth center means a facility that the primary purposes of which are to provide midwifery care, low-risk deliveries, and newborn care immediately after delivery. 1 in 4 women don't get to bring a child home. They don't get to delivery. They may suffer from miscarriage while maybe not needing to go to a hospital, but needing some sort of provider. Would an individual suffering from a miscarriage, would they be able to go to one of these birth centers?
It is my understanding that the birth center is, is directed toward pregnant family. Many birth centers offer services for that type of population that you're talking about, but that would be separate from the actual maternity care.
Okay, and just so I understand, part of the bill also includes adjacent provisions of the center that may be included, or support for miscarriage may be included in that language, correct?
Correct.
And sorry, back to the doula, it's a sticking point for me, I guess. Did the committee hear anything on how to ensure that doulas are available in these birth centers, or how we could include them in maternity care providers?
Not specifically.
Okay, thank you, member. I want to be incredibly clear. This bill is great. Anything that is going to support maternal care, I think it's important that we all understand that everybody's body is different, and it's really important that we give options. I'm just concerned that there may be some support systems in here or that aren't in here that I would like to see. I will be supporting the bill, so I thank the member.
The question is, shall the House propose to the Senate to amend the bill as recommended by the Committee on Health Care? Are you ready for the question? If so, all those in favor, please say aye. Aye. All those opposed, please say nay. The ayes appear to have it. The ayes do have it, and you have proposed to the Senate to amend the bill. Now the question is, shall the bill be read a third time? Are you ready for that question? If so, all those in favor, please say aye. Aye. All those opposed, please say nay. The ayes appear to have it. The ayes do have it, and third reading is ordered. The final bill on our action calendar today is Senate Bill 28, which is an act relating to access to certain legally protected health care services. Member from Winooski.
Madam Speaker, I'd like to make a motion that we postpone action on S28 for one legislative day.
The member from Winooski moves that we postpone action on Senate Bill 28 for one legislative day. Are you ready for the question? If so, all those in favor, please say aye. Aye. All those opposed, please say nay. The ayes appear to have it. The ayes do have it, and you have postponed action on Senate Bill 28 for one legislative day. Members, that completes the orders of the day. Are there any announcements? Member from Burlington.
Madam Speaker, I'd like to remind members that tonight from 5 to approximately 6:30 or 7 p.m., we are going to have a meeting of the Legislative Universal Healthcare Caucus. Our agenda is going to be reviewing the current House Healthcare's work on a state healthcare plan, and also to check in about interstate partnership opportunities as we face sweeping federal changes. It's a remote-only meeting, and I will send out an invite to all members and just disregard it if you're not interested. But if so, feel free to drop in. Thank you. It's tonight, 5 to around 6:37-ish. Thank you.
Are there any further announcements? Seeing none. Member from Poultney, can you please offer us a motion to adjourn until Thursday, April 17th at 1 p.m.?
Madam Speaker, I make a motion this body stand in adjournment until Thursday, April 17th, 2025 at 1 p.m.
You have heard the motion. Are you ready for the question? If so, all those in favor, please say aye. Aye. All those opposed, please say nay. The ayes appear to have it. The ayes do have it, and this body stands in adjournment till tomorrow at 1 p.m.